The fifth force is healthcare. And again, this is a new topic, an emergent topic on the screen, and it comes with multiple dimensions. So your point about do these things fit together somehow in a system is the notion that healthcare is emerging on the heels of globalization, and the notion that globalization is improving the welfare, standard of living in many countries around the world, and with that improved standard of living comes the expectation of access to healthcare. So there's this huge burgeoning, if you will, of expectation for demand of healthcare. At the same time, there's the observance of the inherent waste in the healthcare system. And you know the old adage that in an average manufacturing company, 20 cents of every revenue dollar is lost to poor quality. An average service company, it's 30 cents on every revenue dollar. And they say in healthcare, although I've never seen it empirically studied, they say it's 70 cents of every revenue dollar is lost somehow in the waste of healthcare. So those two kind of micro forces playing out, a burgeoning of demand for access to healthcare and an inability to carry the costs of waste currently in the healthcare system offers a huge opportunity in the field of quality, right? To take the waste out as a vehicle to make it more available to a growing population of need. And of course, we'll never get there without public policy. There'll need to be public policy changes around healthcare practice, and I think the quality profession would like to be at the table participating in those conversations so that the large system solution takes advantage of what's known in the world of technology. And then the second thing coming to focus in the future study in the healthcare area are the emergence of biotechnologies and nanotechnologies as huge forces apt to revolutionize the way healthcare is provided. And we can only begin to fathom what nanotechnology is going to do in healthcare when diagnostic tools can be put in our bloodstreams and maybe read by some sensor that we pass on the way out the door, and information sent telephonically to a hospital that calls us and says, you know, today's your day to come in for your heart attack. So we don't know. Those things are going to very significantly change our future, and the emergence of biotechnology and nanotechnology offer huge opportunities for the quality profession to recalibrate its tools, for instance, in the science of measurement. There are huge questions in the field of nanotechnology of how do you measure something whose size is molecular. Yeah. How do you warrant the quality of something whose total world supply can fit in a thimble? How can you tell if it's even there? All kinds of opportunities in the field of quality as those technologies surface and emerge.